Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. This week, Adrienne Adams appeared on a blog like this, where she was speaking with a woman, Chantel, regarding who she is and why she's running for mayor. It was called Candid Candidate Conversations with Adrienne Adams. And it was a joint effort with Win with Black Women and Sisters Lead. I want to show you this conversation because at one point, Net Moore, one of our retirees from New York City Retirees, asked a question in the chat because this was live streamed in multiple places like ours is. And the audacity of Adrienne Adams, not just to lie to our retiree, but to the viewing public and the interviewer without giving her fair background. And I also want to say it is disingenuous to have her speak to that issue without speaking to the facts and allowing her to lie to the general public. And we're going to call that out because you know the New York City Organization of Public Service Retirees takes pride in debunking bullshit. And that's exactly what came out of Adrienne Adams. I would like to see a strong woman take a mayoralty position. However, Adrienne Adams is not it. And if this was more proof, this video proves it yet one more time. And I want to break this down with you as we're watching it. So here is the video where Adrienne is speaking to Chantel, and Net Moore comes up with a question that was put up, and it says, "Are you supporting the New York City retirees?" I want you to listen to her response, and I'm going to pause it to debunk as she's speaking, and it's really only a couple minutes, so it's not long.
Sister Net, about supporting the New York City retirees.
This question comes up a lot. Net, you know I see you, and you know why I see you. New York City retirees have been in our forefront for a number of years now. We have had a couple of bills that were introduced in the New York City Council. My feelings on this are very vast. New York City retirees are near and dear to my heart. They are very...
And that's absolutely a joke because we have never been near and dear to her heart. She only granted me one meeting in the last 4 years. It was a Zoom call between myself and Councilman Charles Barron and one of our litigation attorneys, Jake Gardner. Throughout most of the meeting, she looked down at her phone. She couldn't look me in the eye, and she has still never spoken to me one-on-one. She has never asked for any of this to be broken down. She refuses to hear the facts. So I don't know how near and dear to her heart we are. She doesn't want to listen to the truth. And her video responses prove exactly that.
Well organized, very well spoken for. That said, legislation that has been brought from a council member to the New York City Council to consider for legislation will not accomplish what that legislation is intended to. It has got a good heart, always have, and the previous bill. Great intentions to handle something that should have been handled by other entities when it comes to collective bargaining.
And that's absolutely incorrect. It should not have been accomplished in collective bargaining because retirees are not in unions, and we no longer collectively bargain. 12-126 says, and that's in the administrative code of the city of New York, that the city will pay the full cost of health coverage up to the HIP HMO, which is the benchmark that the city has to pay up to. We were promised not just by our unions, but by the city of New York that we would have traditional Medicare when we retired. And it was in summary program description books, which was put out by the Mayor's Office of Labor Relations on an annual basis during open enrollment for insurance. And the very body that Adrienne Adams leads today, the New York City Council, legislated 12-126 at the request of then Mayor John Lindsay, because in 1965, after they passed the Medicare Act, he was able to give Medicare to employees by a personnel order. But because retirees were not personnel, we were not in a union, we were not on the job, we were not employees, the only way he can give us Medicare was by legislation through the body that she leads today. That is why that bill is before her. It should not be before a union. It is before her body because her body legislated it. They amended it a dozen times since it was implemented through 2001. Who spearheaded it? The very first African-American female in the city council, the great Mary Pinkett, who represented 2 districts during her tenure from 1974 to 2001, District 28, which ironically, she is a District 28, but I think 28 at the time was in Brooklyn, and District 35. Mary Pinkett was also president of Local 371, DC 37. So there's a long history here that the great Adrienne Adams isn't paying attention to.
That should not have been brought before the city council, but was brought before the city council.
She's absolutely wrong there. It was appropriately brought to her body. The city council is a legislative body. New York City retirees are not in unions, and it was always the city council that passed legislation or amended legislation to protect them because they have no representative in retirement.
Said, in taking a look at the legislation, Sister Nat, what will happen with that legislation if it were to pass in the council? This issue would be a legal battle in perpetuity. So as much as we want to do for our retirees, the legislation is not going to accomplish it. What I want to happen, this is personal, what I want to happen is for the mayoral administration to stop fighting this.
So now what I want to ask her is what she never identifies is if she is mayor, will she stop it? Will she reverse what they've done to us? We have been fighting this for court in 3 years. Here's the other point that Chantel never asks her. The New York City Council is a legislative body, not a judicial body. Her organization, the New York City Council, legislates laws as a law that would serve the people. If there was any question as to its illegality or legality, then someone that opposes that, whether it's another council member, the mayor, a citizen, would sue and bring it to court. And it's been done many times. Some they win and some they lose. That is not up to Speaker Adrienne Adams to say. Adrienne Adams should be doing laws because she thinks they're just, and she's done laws that she thought were just and ended up being illegal. She's also done laws that other people told her were illegal and they weren't. But it's not up to the New York City Council to determine that. It is up to a judge in a court of law, and that's where it should be happening. It should not be up to the Speaker, Adrienne Adams, to say, we're not going to do this law because it will be bound in litigation. New York City retirees have been bound in litigation for the last 4 years against Mayor Eric Adams for trying to claw back Medicare. This whole fight, which Chantel and Adrienne are not telling you, is over New York City trying to claw back Medicare benefits, a federal public health benefit from a retired civil servant, their families, the disabled, 9/11 responders and survivors, our disabled children, line of duty widows and widowers. That's what Adrienne Adams isn't telling you. Adrienne Adams wants you to think we should be afraid of Donald Trump and all these other crazy people, which rightfully, in some cases, I understand why you would be. However, we're more afraid of our own city council and our mayor and our former unions for forcing us into the default plan of Project 2025. Adrienne, a progressive Democrat in the city of New York, isn't doing anything and offered no solution as current speaker or future mayor how she would protect the federal public health benefit of Medicare from being privatized in the city of New York and retirees forced into a Medicare Advantage plan, a for-profit private insurance company that many doctors and hospitals do not accept and is fraught with prior authorization that would wrongly delay and deny their care so that their shareholders can make profits. Adrienne didn't tell you that, Chantel. She didn't. Neither did she tell that to Ms. Eddy. She didn't tell either of you. She didn't tell anyone from Win with Black Women or Sisters Lead what this fight was about. And why is that important? Because in 1965, the Medicare Act was passed, and it was one of the greatest civil rights achievements in healthcare. It prevented people from being discriminated against in access to healthcare. There were no more colored waiting rooms and white waiting rooms, and didn't matter whether you were poor or rich, what your skin color was. If you saw a doctor in a hospital and they wanted to be reimbursed under the federal public health benefit of Medicare, they had to stop segregating care. The plan that Adrienne Adams, by default, is allowing us to be forced into creates that tiered network right again and brings us back to 1960. Why? Because if you are a wealthier retiree, which we are not, I've not hidden the fact that my pension is a $35,000 pension. I spoke today with a retiree from DC 37, Local 372, whose pension is $11,600 a year and lives in Brooklyn. And yet this speaker, a woman of color who lived with union parents, with people who served, and yet she doesn't understand that it is her job to protect a retiree who's not in a union, that would disparately impact her population and ours, and all of ours for that matter, by creating a disparate level of care. And she refuses to acknowledge it. And she didn't tell you that, Chantel or Jataka Eddie.
The retirees deserve to have what they have always had as far as what was originally promised to them. That was the promise made to you by your leadership in your unions. That is what was promised.
And it was also the promise that was made by the city of New York. Remember something, Adrienne, say it with me. Unions can represent and collectively bargain for active workers and their future healthcare benefits. They cannot negotiate or bargain for current retirees. Say it with me, Adrienne. We've been saying this for 4 years, and you have refused to listen.
The legal battles that are going on continually and the appeals that have been going on within the mayoral administration, I believe, should not happen, and hopefully those battles will come to an end very shortly. This has never been a matter that the city council should have been in the face of, to put up as a magic wand to make the situation go away.
Magic wand, your legislative body legislated 12-126. You've amended 12-126 dozens of times by Mary Pinkett, Speaker Peter Vallone, through multiple mayors from 1967 through 2001. That, again, is another lie. I cannot even believe that, well, you're not even looking at her in the face when you're saying it, so I guess you would never look at me. You're lying. This is the body and the place to do this. And no one gave you asked you for some magic wand. We're asking you to preserve what we've had, just like you said we should have, preserve what we've had as a floor for the last 60 years. The unions are free to negotiate above that for them. We're not asking you for a dime more, but the more you wait, and even if we win that case in May, after May's oral arguments, that bill is not going away, Adrienne, because what they're doing is passing backdoor premiums in the forms of additional copays and deductibles on all of our retirees. It is forcing them in their 70s to go back to work to pay for medical care they were promised that they would have for free. That's on your watch, Speaker Adrienne Adams. Bankrupting them for costs. And why are they why is the union and the mayor, our former union and the mayor, passing those costs on to us? To finance their raises. Say it. Come on. You know that. You know that the reason that they forced us into Medicare Advantage was to finance their raise and their health care on our backs, on your watch.
That is what this legislation would not do. If it were a magic wand, we would have enacted on it a long time ago. But this legislation is not going to accomplish what we all hope will be accomplished, and that is for our retirees to be made whole.
What a lame response. As I am so disgusted in listening to this. So if Sisters Lead would like to speak with us, we are the New York City retirees. If Win with Black Women would like to speak with us, we would love to speak with you. Our organization is the New York City Retirees. We represent all municipal retirees, all backgrounds, all ages, all ethnicities, all titles, managerial, non-managerial, union, non-union, it doesn't matter. We represent everyone. Our organization is looking out for the interest of 250,000 retirees and their children, their dependents, because Speaker Adrienne Adams is not. We have been fighting this battle for 4 years to protect the federal public health benefit of Medicare that we were promised by the mayor and the city council, a body that she leads today. She's being disingenuous. She doesn't deserve to be mayor. She doesn't even deserve to be speaker. And that is another episode of Debunking Bullshit. And this time, Speaker Adrienne Adams. Have a good night.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision is